Hello. These videos will describe what to expect with a medication abortion. You will have access to these videos and will be given written instructions and emergency contacts, so don't worry about writing this all down. If you have any questions or concerns, please reach out to us. You have different options for how you choose to have an abortion. A short procedure can be done while you are awake in clinic or asleep in an operating room, or you can take medications, which is called a medication abortion. However, it is important to know that this will be done without an ultrasound, and because of this, there are some things to be aware of. The main reason healthcare providers do an ultrasound prior to an abortion are 1, to know how far along the pregnancy is, and 2, to make sure you do not have an ectopic pregnancy. An ectopic pregnancy is a pregnancy that is growing outside the uterus, usually in the fallopian tubes. An ectopic pregnancy cannot develop into a baby because it would outgrow the fallopian tubes. At that point, the tubes could rupture and this would cause pain and internal bleeding, potentially endangering your life. By not doing an ultrasound, we do not know with certainty where your pregnancy is, and if you have an ectopic pregnancy, we might not know it. If you have an ectopic pregnancy, the medication abortion will not be effective, but also would not make the ectopic pregnancy any more dangerous. Keep an eye out for severe abdominal pain, especially pain located on only one side, as this would be a sign of ectopic pregnancy. If that happens, we recommend that you call us or go to the emergency room. In addition, without an ultrasound, there is a chance that the pregnancy may be further along than we estimate based on your last period. Medication abortions are for patients that are 11 weeks pregnant or less. If you have a pregnancy further along than this, there is a chance that the medications would work, but you would pass a larger fetus at home, or that they would not work, and you would need a procedure to have a successful abortion. Although medication abortions are safe and effective for those with early pregnancies, there are some risks you should be aware of. Risks of medical abortions include, but are not limited to, heavy bleeding with the possibility of needing a blood transfusion, infection, failure of the medications resulting in continuing pregnancy, or the need for additional procedures or medical treatment. It is important that you understand these risks and keep all follow-up appointments to ensure that the medication abortion was completed successfully. The risk of these complications are low. Let's move on to the second video to discuss what exactly a medication abortion is and the medications that you will be taking.